So me coming to Jackson, living in a small town in Columbus, it was just like I didn't know like what STDs, HIV was, or none of that. So me and my friends went and got tested. Everybody came back negative, and yeah. So being able to disclose to my parents, my mom primarily, it was just like not only am I telling her that I'm gay, but I'm positive at the age of 16. So it took me for a loop.
I didn't pretty much know anything about STDs or any STIs until I moved here to Jackson, Mississippi, and started to get more into the community, and that was around like 2016.
You know, oftentimes people in the rural community say they feel so isolated from the work that's going on. They're, unsure how they fit in, they're forgotten, and we need to fix that. We engaged communities in the sense that we trained people to go take information back to their community, to share it. They became trainers, they became advocates. One of these posters that you see on the wall, people were equipped with different proverb posters that they could see, so they could go in the community, put up their posters, pass out training materials, and help people be involved and learn.
Youth in the state of Mississippi don't always get access to those resources and information, and that's really sad and actually tragic, because we don't tell cancer patients that they can't have access to information about their bodies. What we want to do is make sure that youth and the communities in which they live are really given information to protect themselves. And one way we do that is through peer-to-peer sex education, having youth have conversations with their colleagues, with their friends, to make sure that they're getting that access to information and resources.
I kind of had a scare, and I met this guy, major pioneer in the community, and he pretty much pushed me to Open Arms.
Open Arms Healthcare Center is our primary healthcare clinic. I mean, we started this clinic in 2013 with this idea of providing, maybe HIV care and maybe PrEP, and it grew. And the clinic grew from the minds of the community. In the very beginning, we did an assessment during Pride, and we said, if we could provide you a clinic, what would you want? And they wanted education, they wanted training. We even asked the question, would you be offended if it was an LGBT clinic? And they weren't. We asked them what the name should be, and that's how we came over Open Arms. The community gave us that name. We asked them the colors, what should this be? How should it look? And so from there, the clinic just grew and it grew. I mean, we do HIV and STDs, but that's not enough. We also provide blood pressure checks, diabetes, we do mental health, we provide transportation. We have an on-site food pantry, so we provide like a wraparound services to the community, because we know you're not just your HIV, you're not just STDs.
Traditionally, the health department has had the same kind of partners. So we've had the same kind of grants, so we've partnered with the same kind of agencies. And then the HIV epidemic says, this is your time to be innovative, to be flexible, to be, more adaptive, and bring partners to the table that haven't been at the table before. A number of work group and collaboratives have emerged from this, and it's based on our target populations.
Zero, gotta get to zero. Can I get to zero? We can make it if we try. Zero, gotta get to zero. Need to get to zero. We can make it if we try. Zero. against rubber is our first line of defense. Some people live double lifestyles, and that also brings, infection to your partner if you're not practicing safe sex. So I go around and I promote that by spreading condoms, spreading love, and singing how we got to get to zero. And I will not stop doing the work until we get to zero.
Snap your fingers like this. We got to get to zero. We gotta 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 get to zero. We can make it if we try. 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 How y'all doing tonight? Well, my name is Justin Lofton, and I represent biomedical advancements. A lot of the things that you guys here tonight are responsible for, and I'm so grateful for everything that you do. But what led me to this platform on this evening is my own experiences of being a college student who became infected with some other sexually transmitted infections. And I realized that I needed to make an impact to educate all of my Black gay brothers who are identified as MSM, that we can stop the statistic of 1 and 2. And so I stand here tonight in front of you guys, and I will not stop until we get to zero.
All of the work that we do sort of just encapsulates what the Ending the HIV Epidemic Plan is all about.
One of our foundational programs is called Becoming a Healthier You. And with Becoming a Healthier You, you can get glucose screenings, syphilis, gonorrhea, chlamydia, HIV, Hep C, Hep B, blood pressure, glucose and cholesterol. And all of this is for free. And so it is a total package to give you an idea of your chronic health and your sexual health. And it's a free package. And it really just was a platform for what we were able to do.
Like that really helped me, because at that time when I was going through that, I didn't have anybody. I didn't have friends to talk to. I didn't have people in the community that I could talk to who knew what HIV and STD was. So it's just like, okay, man, what to do next? So when I got to Jackson, I felt what a support team is. Being introduced to Cedric Sturdivant, going through healthy relationships, clear, I got more insight on who I really am, living with HIV. Then going into the internship, learning about HIV 101, going through all the classes that I could to make me feel like, okay, I'm not alone anymore.
When I started this work, roughly about 16, 17 years ago, HIV did not look like it looks now. Basically, we were doing prevention activities, and you went to the club, you gave out condoms, you did HIV testing, and that was pretty much it. But around about 2012, 2013, the invention of PrEP, the pill that prevents HIV, it was a game changer for HIV. It actually created a scenario where whether you were HIV positive or HIV negative, it was clear that everyone needed the exact same services.
And we think that's important. But here, again, is a case where young people aren't always privy to information about HIV and AIDS. They're not always given a voice. And so what we're seeing is that there are many increasing cases where young people are contracting HIV. And so in order to impact the lives of those young people, and in order to make sure that these young people are getting the resources and information they need, Teen Health really works to partner with Mississippi State Department of Health to make sure that we're building in communities where there are hot spots or where young people are contracting HIV and other STIs. We're also working with a variety of youth serving organizations, with schools, with faith organizations, community-based organizations. What we realize is that at the end of the day, communities need access to information and resources. And at the end of the day, if Teen Health isn't there, we still want to make sure that capacity within those communities is being built. And so not only do we work with youth, we're all about making sure that once we leave, the resources are still there and that communities themselves can take care of each other. And that's what's really important.
Here we go. I said zero. Hey, gotta get to zero. Whole zero. Need to get to zero. I said y'all zero. Gotta get to zero. Whole zero. Need to get to zero. Come on now. Wait. Hey, y'all. I know if we try. Seven of a try listen, C-E-R, zero. Gotta get to zero. Whole zero. Need to get to zero. Good Lord, Mario. Hey, I gotta get to zero. Hey, whole zero. Need to get to zero. See y'all, quick. Thank y'all very much. Now, why was I so gung-ho about this show? Why was I so mad about the 1 and 2? But I do want to take this opportunity to tell you guys thank you. Because of you all working, I'm able to live 20 years plus with HIV. Yeah. See, it started like this. I was sitting at home with my mom and I tried to give blood at a Red Cross blood drive. And then my mom sitting there chilling, talking, and the health department gave me a call and said, hey, we saw that you tried to give blood at the Red Cross blood drive, but we can't take your blood because it came back HIV positive. And I asked this simple question of, well, what you want me to do about it? And her explanation to me was, hey, if you don't come in by the end of the day, then we're gonna send the police to you. And that was in 1994. So I thought about it and I said, I'm not going because all I knew at the time was HIV ends in AIDS and AIDS ends in death. If you die from AIDS in this day and age, it's like going to the grocery store and dying from starvation. The tools are here. We got it. Maybe I got it too. We gotta continue the conversation. We must continue in action. And over years, we must retain what we have learned. So tonight, you guys, I appreciate this opportunity. This is a dream come true for me. I get to stand in front of the people who saved my life.
If there's someone who became infected at 30 years old and they've been infected for 30, but then they're 60 years old living with HIV, and there's much to learn. Like, what's so different about them? What was different in their lifestyle or their willingness, to make a change that 30 years on, they're still here versus someone who was infected around the same time but passed within a few years. there's a lot to learn, and we can't forget that. We can't, HIV 35 years ago looks a lot different then, now than it did then. I mean, some people, the way it is now, I've gone from working with clients who took, 10, 15 pills a day. Then we moved to, protease inhibitors, and people refer to them as triple combination cocktail. So maybe 3 pills a day, maybe some vitamins. But the HIV prevention, the HIV medication may have been 3 pills. People now can take 1 pill a day. That is some kind of advancement. So when you look at the advancements in medication and in science, it is not unheard of for us to eventually get to 0. That what we have are people who are, part of the chronic disease community, that they're just managing their HIV, but we don't have any new HIV. It's possible to get to that. My hope is with ending the HIV epidemic, although, this is a 10-year plan, that's certainly longer than the standard 3 to 5 years. So in 10 years, a lot of change can happen. A lot of people can feel empowered. And then 10 years also gives us a chance to impact another generation. And then that generation impacts another generation. Think about it. If we're talking to a 10-year-old today, in 10 years, they'll be 20. And during that whole time, we've got them when they're young and they're a teenager, and they're hearing the same message and learning the same information. And when they get 20 and go to college, it's instilled in them. And then they become sort of, the unofficial community health worker for their own population group.
Getting to 0 means more love, more collaboration, and believing that we can actually get to 0. I believe that we can.
Say that the odds are against us, we won't last. The mountain's high, but I have the strength to climb. We must not stop, we must fight till we get to 0.
The outcome isn't based off of statistics. It's based off of believing that we can change the world.
Statistics show us signs of rise and slow decline. But men and women, boys and girls across the land, they know the task once complete won't end in defeat. We can change the world if we try. 0, we gotta get to 0. We need to get to 0. We can make it if we try.
Seems like it's getting worse, but we say
It's getting better.
and even though the battle's hard, we still stand together. We know we can achieve if only we believe
That it
we know it
can
can be done.
be done.
till we